Hello, I'm Dr. John Marshall. I'm the System Medical Director for the Common Spirit Memorial Emergency Departments here in the Chattanooga area. Today, what I would like to do is walk you through the process of receiving your care here at our emergency department. We know that an emergency can be an extremely stressful, sometimes scary event for you or for your loved ones. And we'd like to assure you that here at Memorial, we have a process in place to make sure that you and your loved ones receive excellent care in a quick and efficient manner. I'd like to walk you through the process. Welcome to our emergency department. The first step in this process will be the registration process. You'll step over to the registration desk. You'll be greeted by one of our registrars who will get some basic information to help get your care started. You'll also receive an armband which helps us safely identify you throughout the process. There's also a public safety officer present 24/7. This is our emergency room triage area. This is an area that is staffed by a registered nurse 24/7. Once you enter this area, we will be getting vital signs from you. These vital signs include your heart rate, your blood pressure, your temperature, your oxygen levels. Your triage nurse will also be asking you questions in regard to your illness. The purpose of the triage visit is to not only get your initial vital signs, but to help determine what level of care you'll be requiring while you are here in our emergency department. The triage process is a little different than what you might look at as a first-come, first-served process. While we will always try to get your care started as quickly as possible, sometimes there are emergencies, a stroke, severe breathing difficulties, things that require our immediate attention. And just like we would do for you or your family member, if someone arrives by ambulance or presents here to the emergency department with one of these severe conditions, they will be given first priority, and then we will, as quickly as possible, initiate your care. For many people, the idea of a vertical care area is a new concept. It can sometimes be confusing. I hope to explain some of this. We want your care to begin as quickly as possible, and to allow that to happen, for many patients, their care will begin in this vertical care area. You'll be escorted here by your triage nurse. Once you get here, you'll be greeted by one of our nurses here in the vertical care area. And as soon as possible, one of your providers will be at your bedside or at your chair side to talk to you more, to examine you, and to get your care started. We know your time's important, and we want to make sure that you receive care quickly. Your emergency department roadmap will be posted at various locations throughout the emergency department. If you look at the roadmap, you are here in vertical care. Depending on your results, on the number of ambulances that have been received or the availability of beds, you may complete your treatment here in the vertical care area and be discharged home from this area. In other cases, you may move from your vertical care area to the results pending area, which in some cases may include the lobby where you entered the emergency department. Some individuals, depending on the test results, may need a bed and may need to be admitted to the hospital for further testing. Please be assured that this movement through the emergency department is necessary so that we can make sure that you receive treatment in the area that is best suited for your emergency. I hope that this video was helpful in explaining the processes that we have in place here at Common Spirit Memorial Emergency Departments. Please rest assured that no matter which portion of our emergency department was utilized in your care, that we are doing the best possible that we can to ensure that you receive excellent care, but this care is also timely. You're important to us.